So this is the Purit Benetton ventilator. So Purit Bennett ventilator is composed of the things like various. First, we need to check out the modes of ventilation. From here, we can able to find out what the modes of the ventilator the patients are having. Like AC mode, SIMV, that is a synchronized intermittent mandatory ventilation, is pump mode, bi-level, and CPAP. So based on the patient condition, we will be setting the mode of the ventilation. And then coming to the ventilation, we are having invasive, non-invasive. Invasive is by ET tube or tracheostomy tube. Non-invasive is by the CPAP mask, or even with invasive method we can keep the setting with your respond mode and IV setting. And also, instead of this kind of ventilation, we can also use for high flow. Before we was using air wall settings, but we can also have the high flow in the Purit Benetton ventilator. Okay, so that is there. And main things, we have the setup like this is with the ventilation, this is the apnea setting. So usually, mostly we will be keeping 20 seconds. If there is 20 seconds, the patient is not taking proper breath, then immediately the ventilator starts alarming. Yeah, in case if there is hypoxia on the ventilator, that you are seeing the saturations are getting down, then you can give flush of 100% of flush you can give to the patient. Then this is the alarm settings. This is general for all the patients. Okay, we will be just setting the same thing for all the ventilators. Then this is just extra settings that we need to focus on. But the main things are, we need to have this page focus on. So here, whatever we are setting, we can have the things here as in the background. So pressure support 10, PEEP of 8, and FiO2 of 40.